Let's talk about age-related macular degeneration. So what is AMD? AMD is incredibly common. It affects patients age 50 and over, and the macula, which is the central part of the retina of the eye, undergoes aging changes that involve the accumulation of waste products and inflammation. As this process progresses, the macula may degenerate or bleed, causing a reduction in the central vision. What are the symptoms of AMD? So initially, AMD may not present any symptoms, and many patients will not be aware that they have the condition. With more significant disease, central vision will be affected, making reading and recognizing faces more difficult. Distortion of the central vision, where straight lines appear kinked or wavy, also occurs in AMD. Does AMD have risk factors? Absolutely. The main one is simply age. The condition does not occur in those under 50 years and becomes more prevalent with increasing age. Family history is a further risk factor, as is cigarette smoking. So how many types of AMD are there? Broadly speaking, AMD is of two types, dry and wet. The majority of patients have the dry form, which can vary widely between being non-symptomatic to affecting the central vision considerably. Some patients with dry AMD benefit from taking a supplement tablet daily to reduce the rate of progression of disease. A small proportion of patients with dry AMD will transform into the wet type, sometimes called neovascular or exudative AMD. This type of AMD requires injection treatment to preserve vision. Is there a treatment for dry AMD? There is. A large study called AREDS-2 showed many patients with dry AMD benefit from taking daily vitamin and nutrient supplementation, as this reduces the rate of progression of disease by about 25%. It is important the supplement taken has the AREDS-2 formulation of ingredients in the correct doses. There are now emerging treatments for eyes with the most advanced form of dry AMD, known as geographic atrophy. So how is wet AMD treated? Without treatment, wet AMD can progress quickly to permanent loss of central vision. Thankfully, treatment with injections into the eye can stabilize vision and sometimes even improve it. Although these sound scary, many patients tolerate injections very well. The injections are given under a local anesthetic and the patient does not see the needle, as this goes into the white of the eye. Nevertheless, it is important to note that the great majority of patients will need a course of injection treatment, sometimes with several dozen injections.